My name is Radhika. Thank you all for attending today's event. For those of you who attended a Vishwa talk before, a warm welcome back. And for those of you who are joining us for the first time, here's a little bit about Vishwa. Vishwa Talks is a platform to create awareness and to inspire people to participate in social change. Here, we invite experts to discuss and explore diverse opinions, different perspectives, issues, problems, and their solutions. Along with Vishwa Talks, Vishwa provides free computer training program to underprivileged kids, and we are aiming to train 500 students by this June through Vishwa Yuva Vikas program. Vishwa also conducts Annadanam campaigns each Friday, and so far we have offered food to over 6,000 people near hospitals. Through Vishwa events, we have educated 15,000 students till date on significance of our rich culture and heritage to the future generations. This Ugadi, we have successfully completed our material donation drive, through which we have connected over 250 donors with 2,800 beneficiaries, bringing communities together and supporting those in need. So today, I'm excited to introduce our keynote speaker, Mr. Venkat Vakalapudi, an insurance advisor with over 2 decades of experience in this field. He is a member of Million Dollar Roundtable at USA. Mr. Venkat was an IRDAI advisory member in the Life Council board. He continued to be top of the table at MRDRT USA for 15 years. He is a specialist in selling life and health insurance for NRIs for the last 15 years. Recognized for his talents, he was featured in the cover story section of the Forbes India magazine, which was issued in November 2013. Mr. Venkat operates from Vizag, Hyderabad, Chennai, Mumbai, and also Delhi. So, today, before we get started, I would like to inform the audience that our speaker will be taking your questions from you after the main talk. So, please leave your questions in the chat box or use raise hand tool. I request everyone to turn on your webcam for an interactive activity. So, without further ado, let us give a warm welcome to Mr. Venkat as he shares his invaluable insights on health insurance today. Over to you.
Yeah, good morning, Radhika, for nice introduction. And I want to thank you, Vishwa, for the kind of activity they initiated, the kind of social service and educational events they're conducting from long back. And I'm so inspired to have a long journey with this and associate with the Vishwa group. And welcome and thank you very much for people who already joined and who are going to join. Thank you very much for taking your time and know more about health insurance and its importance. Okay. Just give me a moment. Can you share the slide? Let me start with the importance of the health insurance, which is really needed for particularly in India, which is underinsured. And we need to bring a more enlightenment for the people to bring that information and the knowledge about the health insurance and what we should know and what kind of practices we have to do. With that intention, we created this meeting. And Radhika, can you share the screen?
Yes, sir.
So the common questions for is why is needed health insurance? Why it is so essential? A lot of people don't know about that, the importance of health insurance and why it is essential. Primarily, it is one of the important thing was a financial protection, secure future where medical treatment is expensive and be it rising costs like a saving tax under Section 80D and preserve savings. Access to quality care, network of healthcare providers and facilities. Preventive services like cover vaccinations and screenings of detect and manage health problems earlier. Chronic disease management and cover regular visits, medications and treatments. And a legal requirement. I want to explain a little bit more regarding the financial protection. It covers the medical expenses, reducing the financial burden of unexpected health issues. Without insurance, medical bills from serious illnesses or accidents can lead a significant debt. And it won't let any family to live a peaceful and comfortable life. Even most of the people unable to get a proper medication because of the not having a proper money or proper reserves. And access to quality care. Insurance often provides access to a network of healthcare providers and facilities, ensuring that individuals receive timely and appropriate medical care. Before I'm going through, just I want to check that if anybody is not comfortable with my language, English, or my voice, please post it in the chat box, and Radhika or somebody can help us to rectify it. If somebody is unable to understand this language, even I don't mind to explain a little bit Hindi and little bit Telugu also. Okay, please post it in the group. But most of the people, I think that English is the better thing. Okay. And preventive services. Many health insurance plans cover preventive services such as vaccinations and screenings, and which can detect health problems early and manage them before they become serious. But not only the vaccinations, that lot of important this thing. It is like a debit card. The health card is like a debit card. If this is there, that one of the important aspect of our life is really taken care. And lot of areas it supports. One of the important this thing was peace of mind. If everyone is having a health insurance, the kind of peace it will give, such a way that the patient can focus on his well-being, is that whatever the activities the doctor advised to follow, for that it is really gives the proper space. Otherwise, dancing around that, how to procure the money, how to get the money, and how to arrange the money, and which hospital is the best, and how to find the doctor. Oh, that hospital is so costly. This doctor is so expensive. All those conversations will be taken care because the financial need is taken care. If the health insurance is there and it is a proper network hospital, you don't need to worry about the expenses of the hospital and the doctor and the cost of the tests and diagnostic services. So it is very important, influential factor to have a peaceful and a comfortable health sector, health taking care. So this is, as I said, that this is very much important. Now I want to tell you what is the advantages and what is the disadvantages. The advantages are more convenience. The policyholder does not need to arrange large sums of money for treatment. And the speed, immediate access to funds or healthcare expenses, which can be crucial in emergencies. Reduced financial burden, no need to pay out of pocket and then wait for the reimbursement. And paperless transactions, minimal paperwork is involved compared to reimbursement claims. And what is the disadvantages? In this cashless claims, some of the hospitals are not associated with this network hospital group, like network limitations, only applicable at hospitals within the insurance providers network. So my recommendation is, whenever you are taking the health insurance, or whatever the health insurance coverage you are holding already, please check with your agent or advisor or company, wherever you take in, what kind of the network hospital your health insurance is already associated with. If that policy is not associated with the proper and high-end hospitals, please make sure that your agent or advisor will change the policy or shift the coverage or shift the network. Make sure that near to your home, whatever the best hospitals are there, those hospitals, your policy should be networked. Make sure that is very important. The other thing, pre-authorization. If your hospital is not a networked hospital, then pre-authorization is required. Requires from the insurance company for planned treatments, which can sometimes delay procedures also. That you need to be prepare first. In reimbursement claims, the process is a little lengthy. The process is the policyholder has to pay for medical expenses upfront from his pocket, and then submit a claim document to insurance company for the reimbursement. That's not so easy. And the insurance company reviews the claim and reimburses the policyholder based on the policy's terms and conditions. Because of this, the cashless is the more convenient and more peaceful way to have the benefits of the health insurance. But there are some kind of advantages in reimbursement claims also. What is that is a flexibility. Can be used in any hospital, not just to those within the insurance providers network. Suppose some of the treatments, some specialist doctors working in a different hospitals where your insurance policy or any insurance company is not networked with that. In those kind of areas, this flexibility will be helpful for anybody. And choice allows the policyholder to choose their preferred hospital or healthcare provider. And the disadvantages, I told you, the financial strain. The policyholder needs to have a sufficient funds to pay for the treatment initially from the pocket. And the documentation requires a thorough documentation and submission to all medical bills and prescriptions and reports. That is also one of the tedious work. And the processing time. Reimbursement claims can take time in process, leading to a delay getting in money back, and a couple of times you need to do the follow-up calls. Choosing between cashless and reimbursed claims. Emergency situations, cashless claims are often preferable in emergencies due to immediate financial relief. So majority of the thing I recommend taking the cashless policy with a good network hospital is always recommendable. Now I want to talk about the misunderstood understandings about health insurance can lead to financial difficulties and unmet healthcare needs. Common misconceptions include people will think that I have the insurance policy, everything is taken care. It's not correct. All medical expenses are covered. That is also one of the assumption. That is also not correct. Reality is not all expenses are covered. Policies have exclusions, limits, and specific conditions for coverage. Some treatments, pre-existing conditions before the waiting period, cosmetic procedures, the non-essential services may not be covered. Like that, the room rent cappings. All policies won't cover the 100% of the room rent coverage. When you taken the policy or when you're having the policy, I want you to check that what is the limitations and exclusions you have. And one of the other assumption is my coverage starts immediately. As soon as you pay the premium, there is an assumption that my coverage starts immediately. The reality is health insurance policies often have waiting periods for certain conditions, including pre-existing diseases, maternity benefits, and specific treatments. Emergency coverage may start immediately, but other benefits might take several months to years to activate. My recommendation is when you holding the policy or when you buying the new policy, first understand that what covers from when it covers. What is the pre-existing ailments you are having right now? Is that covers or not? If that covers, from when it covers. You check with your advisor or your bank or your insurance company and note down with your own language. All the insurance policy the document, some of the terminology you might not familiar and it may look like something understand in your own way. For that, I want you to check with your advisor what it means, what it is and what it is not. And note down in the policy document in backside some white paper, some diary, what is your policy covering, what is not covering, what is your network hospitals, what kind of treatment it is covering, what is the limitations. Please note down in your own language. And pre-existing conditions are always covered. That is another assumption. No, it's not covered. Pre-existing conditions are covered in a group health insurance. I will explain you what is group experience later. Okay. And reality is coverage for pre-existing conditions usually comes with a waiting period, which can range from a few months to several years. Some policies may not cover certain pre-existing conditions. Certain conditions won't, certain diseases won't cover forever. I want you to check what it is and what it is not. Suppose cosmetic coverages won't cover, even though after some time also. Some of the acupuncture, some of the traditional and Ayurvedic, some of the policies won't cover the treatments. I want you to check and note down. Then that will give you peace of mind. And another assumption is cashless treatment is available anywhere. The reality is, as I said earlier, cashless treatment is not only available in network hospitals. Receiving treatment outside this network requires paying upfront and seeking reimbursement later. And once insured, always insured. That is the another assumption. Policies are subject to renewal terms. Insurers can refuse to renew based on claims, history, or significant health changes. Regularly reviewing and renewing policies is very crucial. Your health insurance policy is limited to for only 1 year. You have to renew the policy after a renewal period is over or before that. But subject to change, basing on your health conditions, your claims history, your insurance company is willing to renew this policy, or they may increase the premium, or they may change some coverages. There may be some changes. So for that, I want you to check that your policy is on force or not. That is one of the important aspects. And another assumption is cheaper premiums means better deals. It's not correct always. The reality is lower premiums often come with higher deductibles, co-payments, or limited coverages. It's important to balance premium costs and with the comprehensive coverage needs. You should not discount the coverage for the reducing the premium. That you really need to take care about. That assumption, you have to know that. And another assumption is health insurance covers everything. The reality is policies have specific exclusions and limitations. Cosmetic surgeries and alternative treatments and non-prescription drugs are commonly excluded. Reading the policy details is essential. And another assumption is insurance companies always pay the full amount. No, that's not correct. The reality is many policies have sublimits and co-payments. Insurers may only pay a portion of the total bill, requiring policyholders to cover the rest. Another assumption is healthy individuals don't need a health insurance. That's not at all correct. Each and every human being need a health insurance for a peaceful treatment, peaceful well-being. That is well needed. The simply saying the benefits of health insurance is comprehensive and timely coverage and cashless coverage at network hospitals and tax benefits, and family health cover and a cumulative bonus for additional care and a peace of mind in emergencies. Whatever I explained till now, for this purpose I explained all this now. I want to explain about key terms of health insurance. There are some terminology. When you are buying a health insurance, some kind of the terms you are not familiar or you don't know what it is and what it is not. The one of the key term of health insurance is deductible. What is deductible? The amount the policyholder must pay out of the pocket before the insurance company starts covering the expenses. Higher deductible typically results in the lower premiums. And I recommend take a full coverage with a less deductible. Otherwise, you won't enjoy the benefits of the health coverage through insurance. In some of the cases, whoever is having some ailments, where the insurance company is not willing to cover 100%. In that cases only, I recommend to take a sublimits or deductible. The next one is co-payment. Co-payment is, suppose every 1 lakh claim comes. When you are taking the policy, there is a co-payment option. 10% I will pay, or 20% I will pay, or 50% I will pay. That is the option. Usually this option when a employer is taking the policy for employees. To secure the policy or to control the misusing of the coverage, usually employer put this 10%, 20% or 50% co-payment option. Such a way that the employee will be manage the policy in a responsible way. So his pocket he has to pay some percentage and some percentage through company policy employer will pay. This is the co-payment option. This is called a co-pay. The another term is co-insurance. The co-insurance percentage is usually won't impact on the customer. It is in between the insurer to insurer. The insurer will do the co-insurance with other insurer also to do the sharing of the risk. It is company to company. And out of pocket maximum, on another term, the maximum amount the policyholder must pay for covered services in a policy period. After reaching this limit, the insurance company pays 100% of covered expenses. That is the minimum pocket expenses. There is a term in the policy. Before you are taking the policy or your existing policy, I want you to check that. And exclusions, another term is exclusions. Specific conditions or treatments that are not covered by the policy. Common exclusions include cosmetic surgery, certain experimental treatments, and alternative therapies. Those things usually exclusions. And please be mindful, what are your policy exclusions? And the waiting period. Most important time is a lot of people will get upset when they came to know that their policy is, the risk is not covered, there is a waiting period. Usually for diabetic and high BP, these kind of ailments, that insurance company will put a waiting period, 2 years, 3 years, 4 years, depend upon the diagnostic reports. And please be mindful about when your policies after waiting period covers the certain diseases. And another term is pre-existing condition. That is also existing disease only. For the disease, what is the depend upon the medical condition that already exited before the start of the insurance policy. Coverages for these conditions often comes with a waiting period. And some diseases, as I told earlier, it won't cover also. And another normal term is claim. A claim is a request choosing the right health insurance policy involves careful consideration of various factors to ensure it meets your healthcare needs and financial situation. When something happened to you, when you are applying for the reimbursement or cashless, that's called a claim. That is the term from insurance company. All this process, choosing the right health insurance plan is very mandatory. Then only you can have the proper benefits of the health insurance. Uninsured people receive less medical care in a timely manner, have worse health outcomes, and large financial burdens. The benefits of expanding coverage outweigh the costs of added service. Friends, you might see that a lot of families, whatever the disease, some cancer, something comes, they need to sell their properties and they need to get the loans, and some of the deaths are happening just because they're unable to bear the cost of the health insurance. A lot of people become a bankrupt for health risks. So health insurance covers really in a better way if you choose in a right way. Further, the step one is go for a high sum assured. Why I said high sum assured is, if you are taking a high sum assured, the premium rate is less. If we can distribute like a base policy and top-up policy, I am going to explain that. Take a small top-up policy like 5 lakhs or 10 lakhs coverage, and rest of the 40 lakhs or 90 lakhs with very less premium. You will get up to 1 crore. Some of the diseases, some of the hospital expenses, not even sometimes 1 crore is also not enough. But overall experience of the health claims are, approximately 70% of the claims are below 10 lakhs. But nobody knows who will fall in the cadre of the 30% pool. So for that purpose, everybody, I recommend minimum 50 lakhs to 1 crore health insurance is really required. For that purpose, go for high sum assured, the minimum 5 to 10 lakhs rupees base policy. Rest of the policy is in a top-up policy. While you are taking this policy and base policy and top-up policy, the second step is compare the premiums. Which company is offering for your age what premiums and how many years? What I mean by how many years is, one is that I identify which company is giving you lifelong, like 80, 100 years, which company is offering the policy. The second is, some of the premiums are not yearly premium. Some of the top-up policies are offering for 3 years premium also with the less premium. If you pay at a time for 3 years, you don't need to pay every year. After 3 years, again, you have to pay like that. And while you are paying this, taking this policy, buy a family floater. That also will give you advantage of the less premium. Suppose if you are taking a 10 lakhs rupees policy in your family member, like wife, husband, and 2 kids, whoever is getting any treatment, anybody can use this 10 lakhs. In the process, your premium cost is very lesser. The next thing was consider waiting period. As I said earlier, this waiting period is very crucial. Check that they depend upon your age and your pre-existing any diseases. The next thing was compare health insurance. How to compare health insurance? Their premium value, their service, their claim settlement ratio. It is available in the Google. Just to type it, claim settlement ratio of like Tata AIG, like Star Health, whatever the Care Health Insurance, Magma, these companies' names health insurance, you can check and it is available in the Google or IRDA website also it is available. And I strongly recommend go for a lifetime renewable plan. Lot of insurance companies may offer policies till 60, 65 or 80. But make sure which company is offering whole life. Those kind of policies I want you to take. Why? Because majority of the people up to 50, 60, there is no hospital need and there is no requirement. But majority of the claims come after 55 or 60. Make sure that entire your lifetime, your health insurance is covered. Radhika, can you change the slide, please? There are different types of health insurance. That is individual health insurance that person is taking on his own life for himself. Next is a family floater health insurance. The group of family, like parents also you can include, children also you include. It's a group floater health insurance. Like a senior citizen health insurance plans. Why it is a separate plan? Why? Because senior citizens often they need to have the hospital visits. For them, the premium limits are higher, premium cost is higher. So it is better to take a senior citizen health insurance for people who are above 55. Next, critical illness plans. Critical illness plans, some of the health insurance plans won't cover the cancer and other things in 100%. There are some limitations. There is a specific health insurance policies particularly covers the critical illness plans. Like maternity health insurance schemes. Usually a lot of schemes will cover only 50,000 or 1 lakh rupees for maternity claims. So people who want to have a more benefits, I want you to see the specific maternity health insurance schemes. That really helpful for the kind of hospital and treatment and doctor you are going to use. Identify the costs there and make sure that that kind of health insurance plan you are taking. And a group and employee health insurance, it is very critical and important. There are a lot of advantages and disadvantages here. As I said earlier, there is a waiting period for the individual policies or a family floater policies. In this employee health insurance, there is no waiting period. Whatever the diseases are there, from the day one of the policy, it will cover. In group health insurance policy. But what is the guarantee you are going to continue in that group, in that company? That is a disadvantage. Usually people will retire at 60. and health insurance is required after 60. So recommendation is, if you are an employee or employer, having a group health insurance is really required. At the same time, apart from the group health insurance, having individual health insurance also recommendable. Why? Because after 60, if you are retired from the company, nobody will take care. That is the reason you should have balance this and that both. Anyhow, your employer will pay the premium for the group health insurance. You need to take care about your own health insurance. And preventive health care depend upon the family history, last 2-3 generations. Any kind of preventive, any kind of pre-existing and exempted diseases or disorders are there, I recommend to take care about that, to take the preventive healthcare policy. Like surgical benefit policies, there are specific benefits for surgical benefits. I want you to check before you are taking that. And student policies, normally, usually, a lot of students go to different colleges out of station, out of the country. I want you to check that what kind of policies will cover for the students. Suppose students going to out of the country, some of the colleges in out of the country, the colleges itself providing health insurance for the students who are studying their college. Those are, even though if it is a little costlier also, they will have the cashless facility in those hospitals in that country. So if you are taking a Indian travel health insurance student policy, some of the policies may not have the cashless schemes in out of the country. So instead of you sending money for the student healthcare to hospital charges for reimbursement benefit, it is better to take the local policy there. Like that kind of knowledge you should have before you are having it. And personal accident covers. This is one of the best thing. And before you are buying from an agent or advisor or a bank, first of all, I want all of you to use the government schemes like PMJJY. One of the cheapest insurance policy for 2 lakhs rupees, Indian government is covering for 12 rupees per annum. For 12 rupees, you will get a 2 lakhs personal accident benefit. More than that, if you want like a 1 crore, 2 crore, you can buy. You should buy. You should have a highest sum assured in a personal cover from directly through advisor, agent, or your insurance company or bank. And another thing was international travel and health coverage. This policy, along with the health, lot of other benefits are there. Like suppose your flight was cancelled. Your flight was delayed more than 6 hours. Your baggage did not come within 6 hours. All those things are covered in this. And I am a frequent traveler. I am one of the best beneficiary out of this policy. Almost every 3 to 4 trips, once I lose, I don't get baggage along with my flight. Maybe it will come in next day or second day or third day. Every time I am getting some $200, $250 for my initial purchase of initial needs. The premium is very less. Suppose usually I take a 1 million premium, that is hardly 15,000 rupees per annum. That covers 1 million of my hospital accident, baggage, delayed flights, cancelled flights, any kind of accident. Everything will cover. That is also well needed for all the international travelers. And this international travel policy is more cheaper than other countries. If you are taking in India, it is cheaper than the other countries. And micro and social security schemes, it is covered by governments usually. And like Ayushman Bhava, like Arogyasri, and these kind of schemes, I want, if you are not using it, but make sure the maids working at your home and the drivers working at your home and office, and all these people should use this micro and social security along with this government schemes. Make sure that if they are not buying, you should buy for them and make sure that they are taken care. Like Ayushman Bhava and Arogyasri. Usually in Andhra and Telangana, it is Arogyasri. In other states, mostly central government scheme is Ayushman Bhava. And even the personal accident covers also, the accidental medical benefit is covered with all tables. I want you to check that. Those policies, if you can take for the people who are working as a drivers and cooks and maids and household helpers, they must have it. And now the important thing about I want to tell you the super top-up policy. Earlier I told about that. The super top-up health policy is to save your premium money cheaper than the regular mediclaim. Use it to get a large cover at a lower cost and add-on policy to a base mediclaim policy. Useful only when you have a claim over. Otherwise, with a less premium, with a base policy, you can survive. And best suitable for salaried and elderly. Radhika, can you change the next slide, please? I want you to see the comparison here. The first slide I am showing is health insurance base plus top-up quotes here. That family type is family floater policy, age 40 years, and family size 2 adults and 2 childs, and pre-existing diseases nil. Let us see. If you are taking a Niva Bupa Reassure product for 10 lakhs, 10 lakhs is a base coverage. Premium is for the people, 4 people, 27,155 per 10 lakhs coverage. If you are taking 1 crore policy or above on the base policy, that is 3,694 rupees. See the difference. That's what I'm telling. For 90 lakhs rupees, with this 1 crore coverage, the coverage starts from after completing the 10 lakhs. The 10 lakhs will hit first in Niva Bupa policy. After 10 lakhs completed, the second policy is Liberty. That is the top-up policy. The rest of the 90 lakhs, if it is required, that will hit on the top-up policy. The total 1 crore policy you can take for 30,849 rupees for the age 40 years old. The same case, if you are taking 1 crore policy in the Niva Bupa, that is costing you around 1 lakh rupee, approximately. The second example, HDFC Ergo, the product is Optima Restore. For the 10 lakhs rupees policy, the base premium for 10 lakhs for 4 people is 29,759. For same policy, the Liberty top-up is 3,694 per 90 lakhs coverage. For total 1 crore coverage, you are taking 33,000, you are paying 453 rupees. The same thing with the Star Assure. It is a little bit costlier, little bit higher, 33,013 rupees for both. And care is also care is cheaper than everybody. For this says this product, Care Supreme, 10 lakhs. The premium is base policy 20,036 rupees and the top-up policy is 3,694. So total per annum is 23,730. Friends, this 23,730 is you can take the exemption from your income tax. You don't need to pay. It is a free of cost. If you can use your taxation properly, if you plan, this is a free of cost. You can take this as an exemption. And all about these policies, auto restore benefit is 100% up to sum assured. No claim bonus for claim-free year as per companies. Is company to company difference will be there. What is auto restore is, that's called no claim bonus. If you did not use any claim, automatically depend upon the company and the policy, it will double the coverage. Suppose Niva Bupa 50%. Suppose you taken a 10 lakhs policy, you did not use any claim. Next year for the same premium, your coverage will be 15 lakhs. That is 5 lakhs no claim bonus automatically you will get. If it is a same HDFC Ergo and Care also 50%, this thing will be there, benefit. But if you are changing the company in between, you have to lose this no claim bonus. That you need to keep it in your mind. This is very important. If you are not using the claim, you will get a 50% no claim bonus. If you are changing the insurance company, you will lose the no claim bonus. This is very critical, this thing. And example of the top-up quotes, 2 adults, 2 children, 10 lakhs base cover, coverage 1 crore, Liberty is 3,600, Star Health is 9,300 and Niva Bupa is 7,600. I recommend Liberty for the cheapest cost, but you are not losing anything. You may ask a question, why the premium difference is so much company to company? The reason is, depend upon the risk rating of the insurance company and their claim rate. They will reduce the premium, they will increase the premium, depend upon their claim ratio. So I want you to see the claim experience settlement ratio of the insurance company and their premium. I want you to compare. If you are unable to do that, prepare these questions, ask your advisor when you are buying the policy or when you are renewing the policy. At that time, check these questions with your insurance advisor. Suppose if you are not taking the top-up policy, the base health insurance is the right side slide. This is a straight away 10 lakhs policy, 27,000. But if you can add 3 more thousand, your coverage from 10 lakhs to 1 crore, it will be added. This is more beneficial. My recommendation is take a 10 lakhs base coverage and add 90 lakhs top-up policy. Your family will have a 1 crore coverage. Use this benefit. Next slide, please. Yeah, it's done. I think most of the things are done. Radhika, can I go for a question answers? It is already 11:40.
Yes. So before we move on to Q&A, we have a small poll question for the audience.
Yes.
And the purpose of the poll is to understand you a little better so that the topic we bring to you in future is better.
Mhm.
Akhilesh, I request you to launch the poll. And while you take the poll, I'd like to extend my gratitude to all the participants that have joined in today's session and to our speaker, Mr. Venkat Garu. Thank you so much. And now I would like to invite our founder, Ms. Srivani Mullapudi, to take the session further.
Namaste. Thank you so much, Venkat, for coming into our talk and giving us such a wonderful talk. And I didn't even come and meet you, speak to you, request you. Just on a message, you did everything. I really appreciate it. What you're doing is seva, actually. Hundreds of families, not even hundreds, probably thousands of families. Because one of the biggest reasons in India families get into debt is because of health and if not marriage. And when we have Arogyashri, when we have the government supporting us in so many ways, yet we are not supporting not just our own families, but we are also not taking care of our environment, whether it is people working for us, whether it is the suppliers, the vegetable vendor close to our family, whether it is the milk supplier close to our family. We do not in India take this responsibility. I know you and me worked a lot towards seeing if we could cover through Vishwa, if we could help out covering the entire gamut of environment around us. In COVID times, we tried our best, but we didn't actually make it a reality. But I hope that every single person who is present in this webinar understands that each of our responsibility is not just me, my spouse, my children. In India today, each of us has a responsibility to ensure not just the staff who are working with us, our drivers or cooks or maids, but also our vegetable vendor, our milk supplier, the entire gamut of people around us. My request, special request to each of you, it doesn't cost more than 12 rupees an annum. Please ensure they're covered. This was an initiative both Venkat and me wanted to take it forward, but we didn't succeed in it. But this is my special request to each of you. And once again, thank you, Venkat, so much. And thank you
for giving this opportunity.
Thank you, Radhika and the Vishwa team. Fantastic work you all are doing. Impeccable. No matter, I know that you don't have any support and you're single-handedly handling everything. There's a little crisis and yet you're handling everything. Thank you so much. And thank you to each of the participants. WhatsApp is not working. Facebook is not working. Instagram is not working. Nothing is working, yet all of you all have come. Thank you to each of you for being present on this talk. With this, we will take a few questions. Shmel, please unmute yourself.
Thank you very much. I too very liked this excellent presentation. And I have a next question. When we are speaking about health insurance, I want to ask you what, according to your opinion, need to be a role of governments and state authorities in health insurance of poor and low socioeconomic groups of population?
Got it. Thank you for asking the very important question. Usually in India, the most of the governments are taking care about the really needy people with the government schemes. One of the best scheme Prime Minister Narendra Modi initiated was Ayushman Bhava. And the last 3-4 years that they're initiating to reach out to all the corners of the country. But there are some kind of educative and motivative and logistic issues are there. And it's need to reach out the best goal and a last milestone it has to reach. But the initiation is very good, but there is a huge gap in reachability. We hope that in the new government that will take into the next level.
Well, I want to continue that same question. Suppose I have an immigrant working from Bihar or Orissa in Telangana. If he takes Ayushman Bhava, will his claim be covered in the local hospitals?
Not exactly, but wherever he is going to the claim, that hospital or that state has to have the implementing that scheme. Usually in Andhra and Telangana, that Arogyasri is implementing.
Okay.
And depending on the different states, the different schemes they has to be applied.
So can a Bihari take an Arogyasri in Telangana?
Yes, with our Aadhaar card you can take.
Oh, is it? Okay.
Yeah.
Okay. Shmel, is your question answered?
Yeah, of course. Thank you very much on elaborated and a very good answer.
Yeah. All right. You said, Venkat, that if you are changing policy in between, you will lose claim. Can you expand on that with more clarity?
Yes. Suppose you are having a 10 lakhs coverage in one policy. Consider that next 5 years or 10 years, you did not use any claim. Insurance companies are offering a new claim, no claim bonus. Company to company, suppose it is 10 lakhs covers, next year it will become a 15 lakhs. The third year it will become a 20 lakhs without paying an extra premium because you are not using the claim. Like that, after a certain period, your actual base coverage of the 10 lakhs will become a 20 lakhs or 25 lakhs. At that time, you are changing the company. Again, you have to restrict to the base policy. This 10-15 lakhs, whatever the no claim bonus you are having, you are already earned from the existing earlier insurance company. That insurance company no more in servicing to you. That's why you have to lose it.
Got it. We have, what are the different insurance companies by the government versus the private institutions in India?
Yeah, in government mostly that there are 4.
Do we have a slide for it? What are the companies?
I did not make it, but I can explain it. Okay.
Okay.
There are 4 government insurance companies named New India, Oriental, United, and National. These are the 4 government insurance companies. And their premiums and their services are very good. But there are standalone health insurance companies. The best one in the top company in private insurance companies, it is a standalone health insurance companies. Those companies will sell only health insurance. That is a Star Health, and Care Health and Nivabupa. And these companies are only health insurance they will sell. But these companies were having very specific coverage policies where government insurance companies are not having. Whether it is a critical illness or cancer specific or different disease specific, these kind of products with a different no claim bonus criteria, they designed products. Even private insurance companies like HDFC, Ergo, ICICI, these kind of companies also were having. Tata AIG is also one of the good health insurance company. These companies are also having a specific products. Depend upon our age and our family history, whatever the threats we are having, basing on that, we can choose the product with the ratings, different premiums.
You said Star Health, Care Health, Novobhopal, and
Yeah.
Tata Insurance.
Tata AIG, HDFC, ICICI.
HDFC, ICICI.
Hmm.
You and in India government, you said New India, Oriental,
United National.
United National. Is there any recommendation that your company suggests, or do you have any kind of a service where you give advice?
Yeah, sure. Definitely, we as an advisory company, that we work for the customer, not for any company. So customer to customer, depend upon their age and their family history, their pre-existing history, all those things we will take into the consideration. Then whatever the company and product is suitable for them, then we will suggest 2-3 companies to our clients, our prospects. Basing on that, our recommendation is to study the client need.
Okay. So do you have a number or something that people can reach out to?
Yes, email ID and WhatsApp. The phone number is shared to Radhika. She said
Radhika,
that
can
she
you
will-
post it online, please? Yeah. Now you were saying that Star Health, Care Health, Novobhopal, Tata Insurance, each one specializes in a special product. Can you give an example, please?
Okay, Star Health is one of the best thing for the holistic coverage of entire Pan India. Their network and they can buy the policy anywhere, any street. The agent network and sales network is there. That is one of the benefit with the Star. And the Tata AIG and Care and HDFC Ergo, these companies are having the internal TPA, that is that internal sanctioning of the claims, these policies. If it is a government companies like New India, United and Oriental and National, they have the third party TPA outside. And the filing and processing, that is also can be done through proper advisory. We need to go through the TPA and get the approval. Here in Tata AIG and the HDFC and the Care, internal TPA within sanction within minutes. So somebody going and joining in the hospital, when the hospital, the insurance desk will be there. If they can show their health card and estimation of the doctor, immediately within half an hour, they will get the approval for the cashless scheme.
How long does it take for government companies?
Maybe 1 or 2 hours for the cashless.
For government companies.
Yeah, government companies.
Okay. When you said cosmetics, when you said cosmetics doesn't cover, if somebody has an accident and there's a deformity in the face and they need multiple cosmetic.
That will cover. That was happened, a damage through
Does-
accident. Yeah, those things will be covered.
Covered?
Yeah.
So when you said cosmetic, non-essential will not, what can you explain that a little bit?
Suppose sometime back, being an insurance advisor, sometime back, I want to change the shape of my nose. Just for my different glamour, different look.
Okay.
Then when I checked my policy, it won't cover.
Okay, got that.
And I want to transplant my hair, my policy won't cover. No insurance company is covering.
Okay. Maternity benefit is something that every woman goes through. So from what age do you suggest they should be taking this insurance so that those costs get covered?
So whenever they're planning having a baby,
Hmm.
1 year, 2 years before that, better to have the policy.
Oh, that's love. That's amazing.
And when they're
Uh,
going to have the policy, what kind of place, like some of the specialty birth clinics are there in, particularly in Hyderabad, like a birthplace and these kind of specialty clinics. They should aware of the entire 1-2 years of the total charges. Even after post-delivery also 1-2 years vaccinations and other things will be there. The total expenses, they should be aware that kind of volume of the coverage they has to take.
Amazing. Then you said room rents don't get covered or get partially covered or fully covered. What do you advise us on this?
See, usually when you're buying a policy, suppose if you are buying a 10 lakhs rupees base policy, you should be aware of that. Usually insurance company, the room cap is 1% of the sum assured or 2% of the sum assured. Okay, and my recommendation is when you are buying a policy, ask your advisor without any cap. Basing on that, the premium will be little bit hike will be there. That is fine, but in some of the hospitals, some 20,000, 30,000 per day also they are charging. Whenever you want to have a the better and the peaceful coverage, it is better to recover fast.
So the government insurance companies cover all this?
Yes, yes.
They
You should
cover all.
ask, I want this. Whatever charge you charge, you charge. This is what I want.
Okay, get that. I'll close this talk now. And for those of you, if there are any further question answers, we will continue after this is done. As Radhika has already mentioned that we have done the Ugadi material drive, donation drive. More than 1,000 people have donated over the past couple of years. 41 volunteers have come forward, and there are around 120 slums in Hyderabad, and around 3 to 8 slums we were able to cover with the material that has been donated. This Ugadi, 200 plus people have approached Vishwa. Our people have gone to their homes, collected, and redistributed in slums. And most of the slums, children are 10th class degree passed. And they were saying that, Ma, the material you have donated, for one whole year, the clothes are sufficient for us, and we don't need to spend money on that this year. So thank you to each of the persons who have donated. I know a lot of Vishwa Talks participants have gone ahead and ensured their entire communities have donated. Thank you so much. And recently we've started computer education workshops in Rajendra Nagar, Tanguturu, Shekpet, MG Nagar, Basti. I have seen many times youngsters are coming for jobs, but they get rejected because they don't have basic computer skills. They don't know how to write a mail. They don't know how to do an Excel sheet. They don't know how to use docs. They don't know how to use ChatGPT. These are the basic skills that Vishwa is training young 10th class, 12th class, and degree students to be eligible for jobs. My request to each of you, for those of you who have old computers, or you know someone who has old computers, or who know companies which are discarding their old computers, please share it with Vishwa. And if you would like to share your phone number, please share it right now. Thank you so much about that. And lastly, I'll talk to you about the upcoming talks. We have a topic on Raja Ravi Verma, the painter of our colonial India. Speaker is Miss Rupika Chawla. She's an author and an art conservator. She's very passionate about what she's doing. And many times in India, we don't know our identity. Our history books don't talk about the great personalities that have been in India. All that is being taught in most schools is Gandhi and Ambedkar and discrimination. Our children are not taught to be proud about their own country. We're trying to cover some of our national heroes. Raja Ravi Verma is one such person. So my request, because Vishwa is unable to market any of its talks to anybody through social media, WhatsApp. Whoever is coming only through word of mouth. My request is, if please take a screenshot of is someone putting screenshot of this and share it with all your friends and family who will be interested, especially youngsters. They need to know what is happening in our country. They need to know the national heroes. So please share it with all of them. We have another talk on Raja Ravi Verma's is on 8th June, 11 a.m. We have another talk, health and family welfare. It is on 15th June, 11 a.m. It's breath and meditation for clarity and calmness. Manasa Pola. She's a MBBS MD pediatrics instructor from Art of Living. We have another talk, healing with needles, an introduction to acupuncture by Dr. Muthu Murugan. He's a senior medical officer at Bepak Pema Wellness. He's the head of the acupuncture department with 2 decades of experience in acupuncture and healthy energy healing. The date is on 22nd June 2024, 11 a.m. Most of us have issues like sleep issues or back pain or something that allopathy is not able to address. And this is a simple 10 minutes treatment that can be given and major issues can be sorted out. In India, it'll be great if alternate medicines are spoken about among all of us so that we know what is available, and if it is suitable to help us in these issues, it'll be great if we can understand what is acupuncture, what is the history of it, how does it work, how does it impact us, and how can such a simple non-intrusive treatment heal huge issues, avoid huge medical bills for us. So yes, please do come to all these talks, share it with at least 10 people in your family and friends. And I would like to thank Vishwa Talks for bringing such pertinent topics. Lastly, please take a moment to subscribe to Vishwa Talks to get alerts on every new and exciting talk, exclusive events, and access to Vishwa community. Many friends and family come and tell me, hey, I didn't get this week's Vishwa Talks. But unless you press the subscribe button, we are unable to send it. Follow us on Instagram, Facebook, YouTube, and LinkedIn for future updates. See you all in the next Vishwa Talks, and subscribe to Vishwa Talks once again. With this, I close the talk. And for those of you who have any question answers or who want to hear any more questions being answered, please stay on. Okay. So Venkat, you were saying that every insurance insurance companies have specific products. You spoke to me about Star Health. You spoke to me about Tata HDFC. What are the other specialities?
Like a specific cancer cover, as I said.
Which
These cancer
which-
covers are most of the companies are having, including LIC. One of the best policies from LIC cancer cover, and
Okay.
other companies are also having that. And some of the like knee replacement policies and some kind of pancreatic diseases, the surgery, this thing like that. There are a lot, n number of policies are there. And see, basically that normal human beings, normal people without having any specific thing, if they can take, as I said, the 10 lakhs base policy without room cap, 90 lakhs rupees top-up policy, that will take care about the majority of the things.
Okay. Can you give us an example of how people who have actually taken a policy, did not do this study, did not check if the room rents have been covered? What is your experience? Give us one experience.
Okay. One of the experiences, one of my close known person who is one of the, familiar industrialist also, he taken his policy some 15 years back. He never used that any claim or anything. But unfortunately, he is not aware about the room cap is 1% on that policy. He have a 20 lakhs policy. Because of this, that his coverage is very less. But of late, last 3-4 years, he have some kind of health issue. He is first in the COVID is the one of the first person to affected with the COVID. Then he joined in the hospital. He need to pay. He is in the good suite room and his policy is not covering that. He need to pay huge money from his pocket. Unfortunately, next 2-3 years with the different this thing, he need to admit to the hospital. And once the policy is issued, we can't change in the same company the policy terms. The second thing, if you want
Oh, you
to
can't? You
once
can't change the terms?
they can change the policy to another company, but the same policy, same company change. The room rent cap can't be changed.
When you renew, you can't change it?
No. That is the problem. The policy underwritings are like that. So if you want to change the company, you can change the room rent cap, but you are losing the no claim bonus from last 10 years. And a free look period and waiting period. Suppose he already affected with the high BP and other things. Now he is changing the company. Again, that company will give the another 2-3 years waiting period. These kind of technicalities we should be aware of it. Did I answer
So,
the question?
yes. There's a question from Nusair Azam. Mr. Nusair Azam, will
Mhm.
it cover the due IRDAI requirement for over 65 years coverage?
Yes, it covers. It covers. And some of the questions I unable to follow the chat box. Whoever is, they have a questions, if Radhika or somebody can send it to us, we can answer and we can give some quotes and examples also to them directly.
There is one question from Mr. M. Ramanan.
Mhm.
I am 75 plus with heart ailments,
Mhm.
diabetes
Mhm.
for over 35 years. Any health insurance for me?
Yes, there will be some health insurance. Star Health will cover and by declaring that all the pre-existing diseases. But thing was, if you are comparing the hospital charges and the premium rates, if no other medicals, other treatment is required for another 2-3 years, but the premium rate is compared to normal person and that pre-existing person is so high. Particularly after 65 of the years, the premium charges are so high. If he is comfortable with the paying the premium, there is a policies. But basing on again underwriter requirements, after seeing all these last 10 years medical treatments and his discharge summary and everything, basing on that only policy issuance will be decided by the company. Provision is there, depend upon the case to case.
80 years also?
Yes.
Okay. Mr. Nusair Azam, very important benefit of health insurance in today's corporate hospital era, the prerequisite plan arranged between the plan and the doctors and hospital.
No, I did not get that
And I
exact.
didn't get the question. Mr. Nusair Azam, would you like to come online and ask this question more clearly?
Is there?
He's there, but he
I,
hasn't.
I think I've come online. I can
Yeah.
see myself in the
Yeah,
laptop.
you are there. Yeah.
Yes, sir. Thank you so much for this. Thank you, madam, for your brilliant summary of some of the issues that are outstanding. So the point I was making, it's not a question, it is more a comment, that one of the biggest benefits of health insurance is not having to deal with the hospital's advisors and the insurance department and so on, because the insurance company has already got some arrangements there. And because of that, you will probably get at least 50% discounting on all of the treatments and the procedures that are offered. Whereas if you try to pay the rates that are quoted on the posters in these hospitals, you'll be bankrupt before you enter the hospital.
Actually, your advice is very good, sir, but the reality is actually a little bit higher. If you are using the insurance, actually on the cash cost and insurance cost a little bit higher. You may be experienced, you may be hard in the industry actually. Then.
That's remarkable, sir, that you can actually get a cash discount. Because every time I've tried for whoever else we've gone in, luckily I have not yet benefited. One other question I had was, I've been trying to get a health insurance policy through online forums. ACO was the one I was trying. And they would look at all the history I'd disclosed, go through the medical tests, and then reject me. But you're explaining that there are some exemptions possible.
Yes, but depend upon case to case, sir. That it is not that should not assume that it is done. No, it is the purview of the medical underwriter.
So check and make sure that you've read all the policy exclusions, all the fine print, all that rubbish. Thank you so much. If you are willing to advise us on that, we will be happy to take your services. The other question I had was, when I've tried to cover the staff working for me, again through this one ACO Health online forum or the platform, they have rejected my staff for having pre-existing insulin requirement, for having pre-existing thyroid medication. It was a benefit in the sense I was not aware that they were using these products. So I'm able to tell them to please be careful about their health for these. But you're telling me that either government schemes or private schemes may be able to insure them after all.
Yes. Okay. Yes. Ayushman Bhava and Aarogyasri, you can cover them. Again, depend upon their age. Depend upon their age cap will be there.
Below 60 is typical.
Yeah,
and Aarogyasri has, they tell me that they're paying out of ridiculous amounts, I suppose because they don't want to wait for the Aarogyasri, the health queue or whatever is involved in that. Right?
Yeah.
Okay. So, whereas through these policies, they can...
I want to continue with this question. Venkat, is Aarogyasri actually functioning in Andhra and Telangana? Can people really go to hospitals? Because are hospitals rejecting Aarogyasri patients because the government is not paying?
Yes, that is the technical challenges, but the scheme is operative. Scheme is operative. But because that hospitals are not getting payment on time, whatever the time they need to spend on the credit patient and the cash patient. The doctors are limited, services are limited. So their priority is where they are getting the immediate money. So that is the technical reason actually. Even some of the cases, the government is paying, or even not only for the Ayushman Bhava and Aarogyasri, even for the regular insurance also, some of the insurance companies, whatever the reasons, the realization of the payment to the hospitals are getting delayed. That is the reason that hospitals will prefer to have the direct cash clients instead of insurance. If you maybe you might have heard that if you are paying through our credit card, debit card, that we will get a cheaper rate than using the insurance. The reason is the realization of the money to their account is the difference.
So that explains the long lines for the government hospitals and so on, and the unwillingness of, the staff are more busy than I am.
Yes. See, if you see the biggest example is during the COVID time, lot of hospitals straight away rejected to admit the patients because the beds are not available, rooms are not available. There is a very hectic situation during the lockdown period. At the time, they given a first priority straight away, whoever is paying the cash, not on the insurance clients. At the time, if you see that IRDA given instructions, if you reject anybody that not taking, then we will suspend you or will put some punishment or something. That advertisement also came in the newspapers.
So how does the common man handle it? Are they at least specific hospitals nearby that are actually getting paid in Aarogyasri that we can get people covered? How does it work?
It's so the dynamics are different. Today, one district may get, today somebody is influential in the government, that hospital will get payment. It is so, the dynamics are entirely different. People has to use some kind of influencer, some kind of, center of influential people to get it done. That is what we learned from the nature as of now.
The environment around us.
Classic India.
Yeah. Mr. Azam, your question is answered.
Thank you so much.
Thank you, sir. Thank you for bringing the important question.
Um, uh, please explain how to select the insurance company's stability. Again from Mr. Azam. Yeah.
Yeah, as I said that claim ratio settlement in earlier slides, one of the slide I said, simply you can go to the Google and top health insurance companies with their claim ratio. Then comparison also you can see that. And service and comments also you can see online which company is giving the good services and this thing. Otherwise, identify the stable, regular, long-standing advisor in your area. Who the advisor, whoever is there more than 10-15 years in that industry, you can rely on them usually. So see, ask them these questions. What is their service? How many clients they have? How many insurance companies they tied up? And if you feel comfortable with them, that you can associate with them.
There is a question from Mr. Abdur Rafiq. Please let me know if Super Top Up is from other companies, how claim will be payable and what for the same company.
Yeah, initially the first claim, suppose if the base policy is the 10 lakhs and super top up is 90 lakhs, first charge will be on the 10 lakhs. Suppose your bill is 20 lakhs rupees, first 10 lakhs rupees the base insurance company will pay. Then the you have to intimate the next insurance company also. Once the total bill reducting 10 lakhs rupees, whatever the excess money 10 lakhs is there, that they have to pay. That is the design of the policy.
So is this also cashless?
Yes. If they are eligible, if the company and the hospital is network hospital, that will be cashless.
So suppose we take from Liberty, will they pay off leaving the first 10 if the bill is come to 30, they will pay the balance 20?
Yeah, they will pay to the hospital directly.
Irrespective of whether the first 10 is paid or not.
No. They have to see that why the first 10 is not paid if they did not pay. Any discrepancy is there in the billing, that verification they have to go through that.
All right. Mr. B.S. Patil, please ask your question.
Yes, sir.
Please unmute yourself. Your voice is not audible.
Mr. Desai, can you able to hear? We can't hear you.
B.S. Patil. Okay, while you get your audio, I'll just cover another question. This is from Mr. Paresh Patel. Which is the best company to choose if there are any pre-existing diseases?
So for that whatever the companies I told you in the government and the private, top 2-3 government and top 2-3 private, you have to apply for everybody with explaining your entire pre-existing. Whoever is coming for offering the insurance, before you are committing, you have to check that. First of all, you have to see the admissibility of the insurance because of the pre-existing, what kind of pre-existing ailments are there. For that, right now, we don't know that who will entertain that, who don't entertain that. First of all, you have to apply for a couple of. Once they agree to give the insurance to you, then you have to decide out of the, suppose 2-3 companies are agreed to you, then who are the best out of the 2-3. That is the way we follow. We advise also.
Okay, this is a question from Mr. A.V. Desai. Which group health insurance policy, same question, covers pre-existing disease? Example, hearing disease requiring surgical procedure in next 1 year with minimum waiting period.
Sir, the hearing surgery was not thrown accidental. It is usually it comes from, either from birth and this thing, or if it is after some accident or something it was happened, any group health insurance, it will cover. It's not an issue. But a group health insurance, you have to be intact. Intact means it is an operational. And usually that, suppose if hearing surgery, suppose it's a cochlear implantation, it costs you some around 5 to 12 lakhs rupees. But the group insurance, that company is covering that much of coverage or not, I want you to check that.
Okay. Mr. Neil Kamal, you want to unmute yourself?
Yes. Yes, thank you. My question is that I am facing some problem. Someone, my clients, he's a cyst. Okay, so he don't know he have that disease. So after taking the Mediclaim policy, after 1 year, he he find out that he have that disease. So Mediclaim company is not given that claim. So how to provide to client to that claim?
First of all, thank you, Neil, for joining the call. Okay. And the answer for your question is, when somebody is taking any policy, whether any kind of health insurance policy, there is a proposal form and there is a declaration. Whether that person is knowingly, unknowingly, whether even he don't know that he have the disease also, but the proposal form is asking, do you have any these kind of diseases or disorders? And he is saying no in that because he don't know at that time. So that is a declaration is already given to insurance company that I don't have these issues. I don't have any pre-existing ailments. That is the declaration given. So after some time, whether it is 6 months or 1 year, even suddenly he came to know about that, it is a wrong declaration. Basing on that, insurance company will have the right to decline that policy. Okay. Suppose for the solution for that is, after some time, if you know that you have that ailment, it is better to reapproach to the insurance company. Just now I came to know that I have this. For that, I want to include this into that. For that, whatever the additional premium you charge, I am ready to pay. If that kind of declaration he can give, some of the insurance companies may consider that. Maybe they can put some kind of waiting period for that. And whatever the treatment are required for because of that ailment, they will put 1 or 2 or 3 years waiting period for that. That is the solution for that.
Yeah, please unmute.
Thank you.
Yeah.
Thank you, sir. Thank you.
Thank you very much.
Thank you.
There are a couple of acknowledgements that have come from Mr. Keyur Purohit. Very interesting topics from Smarita Sen. Ms. Smarita Sen, thank you so much for the vital information in arranging this important session. One more question from Mr. Azam. It's a suggestion for Vishwa Computer Donation Program, add capability to refurbish donated items and make them open sourced based on Linux. We will share it with the people who are conducting this. Then Mr. A.V. Desai, why this Vishwa Talks? No, okay, we've already asked you. Mr. Azam, in the case of Mr. N. Saha's question, it seems safer to declare that I don't know if I have such pre-existing diseases. What do you have to say on that?
In that case, that instead of saying and don't know, better to go for a medical test. Asking insurance company, I am ready to take the medical test. Whatever the medical tests you recommend, I am ready to go for that. Once that medical test is done, that insurance company can't decline that.
Okay, got it. So once the medical test says that ailment is there, they won't take it.
Depend upon the ailment.
Okay. All right. Mr. Patel, did you get your issue sorted out? Okay, why don't you just message it while you can be online.
It's not coming, sir. We are unable to hear you, Mr.
You can type it online. We'll read it out. This will be the last question.
Yeah. I have a group health insurance policy.
Mr. Desai's question, I have a group health insurance policy from my employer and super top up also, base policy, rupees 5 lakhs. My age is 61. Should I take critical health cover separately?
Yes, if you are assuming something, it is better to take the critical health in any specific area you are assuming, you are expecting something. Otherwise, that I wanted to check your employer, what is your retirement period? How many years that employer base policy will cover? Why? Because that you're already 61, maybe in between 60 to 65, you are retiring from that company. Then without having a base policy and the top policy, you will be, it is so threatful for you. Better to take an individual policy along with the employer-employee group policy.
So the transition, if you take for 2-3 years, will it be sufficient?
Yes.
Why is it that is it that Ayurvedic yearly detoxification and acupuncture and alternative medicines, are they covered?
Why it's not covered is it's not in an organized way. There are some fancy boutique kind of setups and some kind of, government managed setups, which is not, approved from all the insurance companies. There are some private insurance companies covering Ayur care also. Depend upon the product, they charge the premium basing on that. Some Ayur care, Ayush care also, some products will cover.
Got that. Mr. B.S. Patel's question. What about multiple policies health if one has?
There's no issue. Anybody can have a number of multiple insurance, but for one disease, one bill, one claim. Whoever is charging, whomever you want to charge, that's it.
So suppose I get a 30 lakhs bill and I have taken multiple policies. Can I simultaneously, because one policy is paying me 5, another policy is paying me 10, can I simultaneously send it to both the policies so that that 15 can be paid over the 30?
Whoever is paying first. Suppose 5 lakhs policies were first paid. Second policy will pay the rest of the 8 lakhs from the 15 lakhs policy.
But not, if suppose the bill is 30, they won't pay. If they won't pay.
Yeah. Already some bill is paid. Either one insurance company or 3 insurance company, 13 lakhs has to pay. But more than 13 lakhs, you are not eligible to take from insurance company.
So 30 lakhs is the bill. One insurance company has paid 5. Second insurance company is insured for 15. So will they pay 15 or will they pay 10?
Yeah, they will pay the 15.
So multiple insurances work.
Yeah, it works. But what I heard was it's a 13.
No, I get that. I hope Mr. B.S. Patel, this answers your question. Mr. Azam, is critical or specific health premium tax deductible?
Yes, of course. Under Section 80D, any kind of health insurance policy, it is deductible up to 30,000.
Okay. Is it true that in the US, I hear that every ailment there's a specific amount a hospital can charge, but here in India, hospitals have no limits to what they're charging. They just fleece the patients. Does though these insurance companies have specific limits for each operation and all, and do they pay only that much? And does the client have to pay the balance?
Yeah, actually, this problem is there in India also. Basing on that only, in India, all insurance companies, they set up an association called GIPSA. And this GIPSA association was that reached out to all the hospitals, and for every ailment and every general surgeries and general treatments, they diagnostic services also. They taken the rates and they have that internal this thing, and they come up with a solution with the normal rate. It's called a GIPSA rates. For the GIPSA rates, all health, whoever is associated with that insurance companies, they have to accept and pay the GIPSA rates. But some of the patients, they did not like whatever the reason, some doctors and hospitals and interiors or rooms or whatever it is, they go into the different hospitals where the GIPSA rates are not agreed or not responded. So they have to pay extra there. It depends upon the insurer to hospital to patient.
So most corporate hospitals follow the GIPSA norm?
Yes. What
So if
difference there is that, room rent charges and diagnostic service charges, some of the other charges they will add it. And in the GIPSA rate also, a lot of hospitals are not agreeing these days because their cost of operation is increasing more than the GIPSA agreed rates.
So what happens then if we are forced to have an operation? What happens if
Insurance
the
companies are paying. Insurance companies are paying.
insurance companies?
It's nothing to do with the patient. It's depend upon the hospital and insurance company, that issue.
Okay. Do hospitals face a lot of issues getting these monies collected from the insurance companies and Arogyasri and all?
Yeah, company to company, hospital to hospital, they are facing some issues. And, both are having, suppose hospital insurance company will say, if you are asking insurance company why you are not paying on time, they say that they're charging more or unnecessarily they are adding some more bills. And if you're asking hospital, they will say that insurance company is so bad and they're not paying on time. So we can't go there and, that is the reason.
Okay. So you said once insured, always insured is not the truth.
Yes.
So most companies have only 1 year, and the other companies have 3. Some companies have 3 years. The
Mhm.
top up companies. So should we pay the premium 1 month before or 1 month after? How does it work?
No. After won't work. Before the due date, you have to pay.
Before the due date.
Usually,
This-
any agent or advisor or insurance company, 2-3 months before they start sending emails and phone calls and for renew the policy, better to pay the before due date. Otherwise, it will be lapsed.
So suppose in 10 years, twice I haven't paid before the due dates, I lose the bonuses?
Yeah. It's not bonus. You will miss the coverage.
You'll miss the coverage.
Mm.
Okay. I think we've covered all our questions from all our participants. Thank you so much for being patient and answering every question. So the last question again, Mr. Smarita Sen.
Yes.
Is it good to go for 3 years or 1 year?
No, 3-year policy is not for the base policy. They are offering for super top-up policies. So anyhow that you have to take a base policy for 1 year and the super top-up policy for 3 years is the cheaper for you. I recommend you to go to the super top-up policy for 3 years, base policy for 1 year.
Okay, sure. Venkat, we need you to come again and have another chat on life insurance.
Sure, definitely. Yeah.
Thank you so